Hi, I'm Mike Heffernan. I'm a specialist dentist. In the UK, 1 in 55 men will get oral cancer. 1 in 108 women will get oral cancer. It's a preventable disease if it's picked up early enough in dental practices. We should be looking really carefully at our patients coming in through the door. It's important. So in our clinic, we always do a soft tissue examination on all our patients.
Okay, Jamie, I'm just going to start your examination with a soft tissue check. Just going to feel underneath your jaw here, around the jawline for any lumps and bumps.
What we'd normally do is we would actually have a look both on the outside of the mouth, where we're checking the jaw joint, down the neck, under the chin and the thyroid.
Now just going to pop inside the mouth. Nice and wide for me, that's great.
Inside the mouth, we check the floor of the mouth, obviously a high risk area, under the tongue, the sides of the cheeks, the palate and oropharynx towards the back of the mouth.
Okay, Jamie, what I'm going to do now, just going to use the oral ID lamp, which is going to show...
We'll then reach for the oral ID and just go over those high risk areas and just make sure that there's nothing else that we're missing from a normal clinical examination.
So I'm just looking for any variation in the colour of the soft tissues there, and that could signify an area of concern.
So the things that we're looking for are areas that will show up black with the oral ID. That shows that there's some sort of pathology there. Now that can be something like lichen planus, but it could also be something more serious like a carcinoma. With this oral ID, we've actually picked up 2 lesions that have been suspicious. It was really handy being able to take a photograph of the lesions with the camera and the oral ID, and actually that showed up even better for at the hospital, that they could actually triage to know if those patients needed to come in urgently or if they needed to be less urgently on the list. And fortunately, neither of them came back as actually cancerous. What I really like about this is actually it focuses my mind onto that clinical examination. It really makes me look at the soft tissue, and it's a simple thing to do. It only takes a few moments.
Yeah, it was a really pain-free experience and good to get the reassurance that there's nothing sinister going on. I think this is a really useful tool for dentists to have. I'd recommend this to people visiting the dentist to have oral ID because it's a pain-free experience and it's really good to get that reassurance that there's nothing going on.
I think this is something that we can use in practice. It's very simple, it's comfortable for patients, and it's very reassuring for them to actually know that you're looking fully inside their mouth to ensure that there's no lesions that need to be referred on to hospital.